Weight loss injections like Ozempic are trending everywhere. But what do pharmacists wish patients actually knew before starting them? Yes, it's the question that we all have, and I have brought Dr. Didi here to address that. So Didi, let's talk semaglutide. What is it? How does it work? And what should patients realistically expect from these medications?
Oh, that is such a fantastic question, Jen. I'm so glad you asked because we actually get this question quite often. So semaglutide is a medication that does the same thing as what your body does naturally. I think that's one thing that our clients are yet to understand. Your body makes this really tiny little peptide hormone that's called GLP-1. GLP-1 is what semaglutide is. It does the same exact thing. So what it does is it kind of communicates in your brain and inside of your gut, and it tells you you're full, you're hungry, don't consume anymore, you've had enough. And what it does is that it keeps that food there in your GI tract for a long time so that you eat less frequently and you feel full faster and for a longer period of time.
Wow. And so if I'm looking at this and considering this, what are the biggest misunderstandings or red flags you've seen in patients who immediately go to these medications?
Yeah, I think one of the hardest things that our patient population has dealt with is the fact that you still have to be super active. You know, we want you lifting those weights, doing those kettlebell exercises. We want you building that muscle because when you lose adipose tissue, which is fat tissue, what is there to replace it? Trust me, you're going to want to have muscle there to hold your skeleton together, but also to replace the fat tissue. When you become more lean, that muscle mass is what contributes to, longevity of life. So the misconception is that, oh, I'm just going to inject myself once a week and I don't have to do anything else. No, you still have to watch what you consume. You still want to make sure you're focusing on those antioxidant foods like your blueberries, your blackberries. You still want to consume a lot of vegetables, your broccoli, your kale, your Brussels sprouts, your microgreens. And then you also want to make sure you focus on your protein. A ton of protein is absolutely necessary or else you're going to lose all that muscle. So I think diet and exercise are some of the key components to making sure that this medication is used in the right way. And it's also going to help you to sustain the weight loss. So when you come off of the medication, because obviously who wants to use medication for a lifetime? Eventually you're going to come off of the medication, but how do you sustain all of that progress that you've made to reduce obesity and morbid obesity?
So it's not a magic pill?
No, it does wonders. It does do wonders, but it's not magic. And it still takes a lot of hard work. Yes.